And so I just want to make it clear that medical malpractice is a tool and it is limited.
We why do we decline the majority of the cases that we see?
You know, there's a number of reasons why we might decline a case. The care sometimes is not below the standard. So, like we were talking about, that legal standard is sometimes even lower than we expect it to be in our common sense understanding. So, sometimes, even though the outcome was really bad, it wasn't below the standard of care. Sometimes the damages aren't large enough to make the case financially viable. So this one is really tough for people to hear, and it's tough for me to talk about with people. But sometimes it's just not financially viable. These cases are really expensive and time consuming and resource heavy. So sometimes the costs of bringing a claim just outweigh the losses that someone has experienced, even when those losses are really high.
Oh, I was just going to say we've been trained as plaintiff lawyers to not take cases where the damages don't exceed a certain amount because the defense lawyers and the doctors and the insurance companies, they have unlimited budgets. In
Yeah.
addition to that, there's the win rate at trial for medical malpractice cases is very low because and reasonably so. I mean, people trust doctors. Doctors are held high societally, and the profession is revered in it should be. It's very difficult to become a doctor, and most doctors are out there trying to do the best they can. Sometimes they make mistakes, and juries often will side with the doctor if it's a close call.
I like to tell people because, I unfortunately have to decline so many cases every day, every week. And it can be really hard for people to hear that they don't have a medical malpractice claim when they've clearly been harmed by the medical system. And so I just want to make it clear that medical malpractice is a tool and it is limited. And so whenever we're not able to take someone's case, I always try to provide them with other options for holding physicians accountable and attempting to repair some of the damage that was done, because a case may not be a good candidate for medical malpractice, but that does not mean that what happened was okay or acceptable. And there are other options often for people to resort to in these really terrible situations.